Let's talk about something that can be pretty stressful, right? Especially if you have a high deductible health plan, paying for medical imaging. You just want clarity, not a bunch of confusion. So in this explainer, we're going to break it all down and give you the tools to actually estimate your costs before you even make that appointment.
So picture this. Your doctor hands you an order for an MRI or a CT scan. Your first thought, of course, is about your health. But I bet a very close second thought is, oh man, what is this actually going to cost me? It's a super common moment, and yeah, it can be really stressful.
What you're hoping for is a predictable, manageable number you can plan for. But the fear, and it's a real one, is that a few weeks from now you're going to open an envelope and see a number that is just shockingly, unexpectedly huge. That gap between what you hope for and what you fear, that's exactly what we're going to fix today.
Okay, so let's dive right into why this whole thing is so confusing in the first place. Here's the number one thing you have to understand. In healthcare, the sticker price is almost never the real price. It's a complicated system for sure, but once you know the rules, you can absolutely navigate it.
This right here is the absolute key. That enormous number you might see on a hospital's website, the one on their official price list, forget about it. Seriously, that's just a starting point for negotiations with insurance companies. Focusing on that number will just drive you crazy.
So if the sticker price doesn't matter, what number does? It's this one, the allowed amount. This is the special discounted rate that your insurance company worked out with the hospital. This is the true price of the procedure, and it's the number that every other calculation is based on. You know, these surprise bills, they don't just pop up out of nowhere. They have specific causes. Things like a vague order from your doctor, or maybe you forgot to check for a prior authorization. Or you get hit with two separate bills, one for the machine and one for the doctor reading the scan. These are all common traps, and the good news is they are preventable. So how do you prevent them? Well, you don't need a degree in healthcare finance, I promise. You just need a process. We're about to walk through a super clear 5-step plan that puts you right back in the driver's seat. And here it is, the whole game plan at a glance. We're going to lock in the details, check your insurance, price the scan the right way, and then make sure we've counted every single piece of the puzzle. So let's break down each step. Step 1 is all about getting specific. Don't just leave your doctor's office with a script that says, knee MRI. You need to ask for the exact CPT code. Think of that code like a barcode for your procedure. It's the only way to get a truly accurate price. Now that you have that code, step 2 is all about where you go. And this is huge. Before you book a thing, you have to verify that the imaging center is in network for your specific insurance plan. Going out of network is probably the #1 fastest way to get hit with a massive bill. Okay, now it's time to check your own stats. Log into your insurance portal and find 2 numbers: how much of your deductible you have left to pay for the year, and what your co-insurance percentage is. Your final out-of-pocket cost totally depends on where you stand. All right, you ready? You've got your CPT code and you're calling an in-network facility. Here is the magic question to ask. You might want to write this down. Can you please tell me the allowed amount for CPT code, and you give them your code, with my name of your insurance plan? This question cuts right through all the noise. And finally, step 5 is how you avoid that last-minute ambush. Ask the facility, does your estimate include the professional fee for the radiologist who reads the scan? Sometimes that's a completely separate bill from a different company, and you need to know that up front. Okay, so let's just step back and see what we've done. When you follow these 5 steps, what you're really doing is building your own estimate. You're taking the procedure's true price, that allowed amount, and you're combining it with your personal insurance status to figure out what you'll actually owe. And this really gets to the heart of it. Let's say a scan has an allowed amount of $2,000. If you haven't met your deductible yet, you might pay that whole $2,000. But if you've already met it, you might just owe your co-insurance, maybe just a few $100. The price of the scan didn't change at all, but what it costs you changed dramatically. This all leads us to the most important mindset shift I want you to walk away with. It's about changing your entire approach from being passive to being active. See, you don't just discover what an MRI costs when the bill shows up weeks later. A useful, accurate estimate is something you build piece by piece using these 5 steps. You're not just waiting for a surprise, you are proactively constructing the answer yourself. This process gives you real power. It's the power to compare costs, to budget for your healthcare, and to ask the right questions so you can avoid those nasty financial shocks. So,
The only question left is, now that you know how to build an estimate, what are you going to do with that power?